All right, so I'm going to be talking and going over the pathways of lower limb venous drainage. Okay, so the first pathway we're going to start with is going to be going to go into the posterior view, then to the plantar view, and we're going to start with the medial. Oops, sorry. We'll start with the lateral plantar and medial plantar vein. Okay. All right, so the lateral and medial plantar vein are both going to drain into our posterior tibial vein. And the posterior tibial vein is going to run up posteriorly, okay, until it gets to the popliteal vein, and it's going to drain into the popliteal vein, okay. The popliteal vein is going to carry upwards, okay, and drain into our femoral vein. And the femoral vein is going to turn anterior, okay, all right, run underneath the inguinal ligament over here, right? Switch names into the external iliac vein. External iliac vein becomes the, or drains into the common iliac vein. Common iliac vein drains into the inferior vena cava, and then all the way towards the heart, okay? So let's examine our pathway of blood from the bottom of the foot, okay? So from the plantar surface of the foot, if I actually zoom in here, you're gonna have our lateral and plantar, our medial and lateral plantar veins, which drain into the actual posterior tibial vein. And from the posterior tibial vein, you're gonna carry on into the um, popliteal vein, okay? Now, after we're done with the popliteal vein, we're going to carry on and turn into the femoral vein. And then the femoral vein runs posteriorly to anterior. Okay, so it's going to turn anterior, cross underneath the inguinal ligament, and become the external iliac vein. The external iliac vein turns into common iliac to IVC, and then IVC goes towards the right atrium and then to the right ventricle. Okay, so that's one way that the blood can come up. Okay. Another pathway I'd like to discuss is starting from the fibular vein. Okay, so right over here. All right. So examining from the fibular vein down here. Okay, so the fibular vein is going to run all the way up. Okay, and then it's going to drain into our posterior tibial vein. Okay, and then the posterior tibial vein again into the popliteal vein to the femoral vein, crosses anteriorly underneath the inguinal ligament, then external iliac, then common iliac, and then inferior vena cava, and then back to the heart. Okay, and so you can examine this from the if we start from the fibular. Okay, so if we start from the fibular, the blood is going to drain into posterior tibial. Once that blood drains into posterior tibial, it's going to go up. Go up where? Popliteal. From popliteal uh, to the femoral. Okay, from femoral uh, to the to the external iliac, from the external iliac to the common iliac, from the common iliac into the inferior vena cava. Okay, so that completes the second pathway. All right, the third pathway is if I start from the short saphenous vein. Okay, short or small saphenous vein, either will suffice. Okay, and it actually starts way down here. Okay, so the short saphenous vein is actually going to drain the lateral site of the venous network. Okay, so the lateral site of the venous network on the foot. And what's going to happen is it's going to, whoops, short saphenous vein going to the popliteal vein directly. So it runs up and drains into the popliteal vein directly, then to the femoral, then to the external iliac, then common iliac, and then inferior vena cava, right? So just a small review of the third pathway of how the venous blood gets towards the heart from the lower body is the small or short saphenous vein is going to drain into the popliteal vein, and the popliteal vein is going to drain into the femoral vein. Femoral vein will start draining into the external iliac vein, external iliac vein into the common iliac vein into the inferior vena cava. And it's as simple as that, okay? So that is our third pathway covered. The fourth pathway I want to cover is the long saphenous vein, or the great saphenous vein, which is actually the longest vein in your body, okay? And it's going to drain the medial site of the venous network. So from down here, all of this is going to drain all of that, okay? And it's going to run, and it's going to drain directly into the femoral vein, okay? And after that, the femoral vein drains into the external iliac vein. The external iliac drains into the common iliac to the inferior vena cava. Okay, so that is the fourth pathway of blood. Um, the fifth one that I would like to talk about is the anterior tibial vein. Okay, and you can actually spot it right here. Okay, uh, right here. All right, so let's start from the beginning. The anterior tibial vein um, is going to drain a small amount of dorsal venous blood on the foot. Okay, it's gonna draw a small amount of dorsal venous blood, so over here, um, and it's going to run all the way up the tibia. It's gonna go posteriorly, okay, and then it's going to drain into the popliteal vein, right? It's going to drain into the popliteal vein directly, all right? Now, once it drains into the popliteal vein, right, you can see that. So anterior tibial, straight to popliteal vein. Once it drains into the popliteal vein, it is going to go to the femoral vein. And the femoral vein, again, as we've said many times already, it's going to go anterior, okay? Cross underneath the inguinal ligament. It's going to turn into the external iliac vein. External iliac vein turns into the common iliac vein, and then common iliac vein turns into the inferior vena cava, or the IVC. Okay. The sixth pathway I want to talk about is very short, and it starts with the internal iliac vein. Okay, so we remember we had an external iliac vein right here. But what does the internal iliac vein do? Well, it draws blood from the posterior side over here. Okay, so those posterior muscles um, on the hip area. But what it actually does, uh, it comes here, okay, and it carries on, and it joins with the external iliac vein to form what we know and love as the common iliac vein. Okay, so the internal iliac joins with the external iliac to form the common iliac vein. Okay, and then that's going to go into the inferior vena cava and blood back to the heart. Okay. All right, so the last pathway I want to talk about, the seventh one, and the last pathway of how the blood is going to get back into the heart from the lower limb is starting from the deep femoral vein, okay, which can be seen right here. All right. Now, the deep femoral vein, it's going to drain into the femoral vein, right? So right here, it's going to drain into the femoral vein at this area where my cursor is. And then it's going to go into the external iliac vein, all right? So after it drains to the deep femoral drains to the femoral, femoral goes anteriorly, crosses underneath the inguinal, turns into the external iliac, drains into the common iliac, and then drains into the IVC back to the heart. But one thing I want to talk about the deep femoral vein here is that it can also act as a secondary way to transport blood. Okay, so if there's a blockage somewhere here, it could actually just take the blood here and then go back. All right, So if there's a blockage in this area for some reason, okay, the popliteal can pass it off in here, and the blood can actually go. All right, so that completes the veins of the lower limb.